Might get a little.
All right, sorry about that. I am back.
He's back.
I have the polls working now. So
You missed my dad joke, Jeff.
Up again. Again, I appreciate that. I'm sorry about this, everybody. It's just gotta love technical difficulties. All right. So you should see, does everybody see a box pop up on their screen? It says Special Smiles Questionnaire Part 1. So there's gonna be 10 questions on here. I ask that we'll go through each question together as we go along. Do not hit submit until we get to the end. We'll submit all your answers at the same time. So now that we have question 1, I'm actually going to pass it over to Nell, who is going to help lead the questions. So Nell, if you want to take over.
Okay. Question 1. How old are you? Please select your age range.
So Jeff, this looks like the answers are just up. Does anybody else?
That's because I made you and Carol co-host.
Oh, okay.
You guys can see it.
Oh, okay.
So
I don't know how to select it either. If I click on it, it doesn't do anything. Is anybody else getting it?
Well, there's some trickling in, it looks like.
I see a couple. Anybody else having issues?
No?
So if you click in the circle, are you able to do it then?
I don't have a circle. I just have how old are you? Please select your age range. And then it just says A, B, C, D, E with all the ages. And then there's a box with 4 different question marks, but nothing is an active.
So you're not getting the poll. There wasn't a poll that popped up?
No, it just says question 1.
Okay, I'm gonna try this really quick. I'm gonna try to.
Mine's not working either.
Not working? Okay, let me try to.
Ours isn't working either.
Okay, yours weren't working either?
Kalina's not working either.
All right, let me try to relaunch it. So I just relaunched it. Anybody able to see it now?
No,
No?
only I can see the questions, but there's no answers.
No,
Oh,
Kalina, no.
No.
It's working on my end.
It's working for us too, both times.
okay. Are some of you on a tablet or a phone or anything like that?
I'm on an iPhone.
I'm
Okay.
on a MacBook Air.
Okay.
We're on a regular PC, so desktop.
And it work for you, Shelby?
Kalina's on a laptop.
Okay. I see a few more. So
There's some answers.
yeah, there's some coming. So this is what we'll do. Again, this is our first time doing it, so we're learning as we go. For those that can answer it, I'll have you answer it. What I will do after this, for those individuals that aren't able to get to work, I will send you a copy of the questions. And then if you want to fill it out, and then you can send it back to me, then we should be able to, again, you can still be able to answer the questions. If there's any issues or anything like that, our clinical directors will still be able to review that information. And if there's are any recommendations, they'd be able to help you with. So again, if you are able to answer it, go ahead. I will send out the questions to people at the end. And again, if you want to fill it out, send it back to me, we'll do it that way. So again, sometimes technology just wants to be a pain in the butt, unfortunately.
Could we just answer in the chat?
You can, if you want to. The only problem if you do it in the chat, it's not anonymous. And there might be some kind of questions you may not want people to know. So I will say, as like I said, that's why I will send it out afterwards. It'll be a little more private. don't have to worry about anything like that, so.
We got about 8 responses, it looks like.
Yeah, so well, again, if you could do it, do it. If not, don't worry about it, just follow along. And I think Karen, you raised your hand. Langfeld, did you have your hand up? All right. Well, now let's just kind of keep going. Again, if you can answer it, we'll have you do it. If not, don't worry about it. So we'll go to the next question.
Okay, question 2. Which category are you? Check all that apply.
So for those of you that aren't seeing the polls, if you look at the bottom of your screen, do you see a thing that says polls on it? If you click on that, does your poll come up?
I don't see that. I see just participants, chat, share screen, record, and reactions.
Okay. Thought I'd try that.
Yeah, it's a good idea.
Yeah, all I see is mute, stop video, participants chat, and share. And leave.
Yeah. Again, I apologize for it. We'll get it figured out. But again, if you can answer it, do it. If you can't, like I said, I'll send out the questions afterwards and you can complete it that way. So
It looks like there's people maybe trying to circle it on the
yep.
on the screen.
But again, the only thing, if you do that, it's not private. And if you don't
Yeah.
want people to know your answers. So again, don't worry.
It's not a bad idea.
Doesn't work.
Looks like their names go away pretty quickly after they, or you can hover.
All right. So now let's go to the next one.
Do you have a local dentist or oral health professional?
All right, then question. Oh. Everybody should have a good dental home that you can visit regularly, check on your oral health. And then the next question now, question 4.
How often do you visit the dentist or a health professional?
We'll go to the next question now.
Have you ever had trouble finding oral health care or finding a dentist?
And again, if you ever need help finding a dentist or anything like that, here us at Special Olympics are able to help you out. So you can always reach out to us if you need help finding one. Next question, Nell.
How often do you clean your teeth? Brush, floss, wipe, or other ways you clean your teeth, gums, and mouth?
Next question.
Do you have teeth?
So it even says even if you don't have teeth, you still need to go to the dentist or see your oral health team. Help make sure your mouth is clean and healthy. If you have any dentures, they'll help make sure that they fit and are functioning properly. And then the next question, I believe, is question 9.
Do you wear dentures, partial dentures, plates, or wear braces?
All right, question 9.
Have you ever had a filling or sealants, silver, white, gold, as a child or an adult?
And then the final question in this section.
Which statement is true?
So chewing tobacco is harmless, e-cigarettes are safe, vaping is safe, secondhand smoke is safe, or smoking can be harmful.
Good.
I feel like that one was set.
Yeah, maybe we could reword
Or
that,
that one. So again, all smoking items have risks. Any smoke increases the risk of lung problems, disease, including cancer and heart disease. Even chewing tobacco can contribute to cancer. So,
Mhm.
all right. So that was the first section. Obviously, didn't go as smoothly as we would have liked. But I'll show you guys, for those of you that were able to answer the questions, if you can see this, it just gives a kind of a quick overview of kind of how people answered. So a good portion of you are between the ages of 19 and 50. All athletes, except we do have a couple parent and family members. That's awesome to see. The ones that were able to answer all have a local dentist or oral health professional. I'm assuming that looks nice too. It's twice a year when you go visit the dentist, or you go more than twice a year. Ever had trouble finding oral health care or finding a dentist? Looks like 60% said no, although 40% said they have had issues finding it. And how often do you clean your mouth, which is brush, floss, or wipe? Majority of people do once or more a day, or then it's 2 to 6 times per week. Do you have teeth? That's everybody that answered it said yes. No dentures. Have you ever had a filling sealant, either as a child or an adult? Oh, it's kind of split. Pretty close. So 60% yes, 40% no. And then everybody got the last question right. So smoking is harmful or can be harmful. So good job on that. All right. So again, I apologize. That obviously didn't go as smoothly or how we wanted to. But do you, Brian or Carol, do you guys have any thoughts on any of the first couple of questions?
Yeah, I mean, back to cleaning your teeth. Obviously, that's very important to brush, floss, rinse with mouthwash. Sometimes you might have to do that more if you're snacking a lot throughout the day. You obviously want to try to prevent food from kind of sitting on your teeth. The old phrase "sip all day, get decay." Pop is obviously very bad for your teeth. You know, just every time you kind of sip a little drink of pop and it kind of sits on your teeth, those acids start to work all over again. The bacteria making acid. So and the vast majority of the athletes we see at screenings, traditional screenings like we used to do, you know, most everybody had great teeth. So I think everybody's doing a very good job, and hopefully you guys all continue to take care of your mouths. And it's a very big part of our overall body health is to have strong teeth and gums.
Awesome, thank you. All right. So usually right now we'll kind of take a little break. So if anybody wants to stand up or stretch, move around a little bit, it's a good opportunity to do that. I know when I had to leave for a second, sounds like you guys were going to do some dancing. So if you want to dance, feel free to do that. One thing I would love to know from a lot of you is if anybody has any Super Bowl predictions. Feel like if you have who do you think is going to go to the Super Bowl? If you want to throw that in the chat, kind of see if a lot of people are thinking if it's going to be the Chiefs or the Bengals, the Niners or the Rams.
Well, we definitely know the Vikings didn't make it this year. Maybe next year.
Yes. All right. Chiefs and Rams. Looks like Chiefs 49ers.
Yeah, basketball. Go 49ers.
49ers. Apologize if there's any Packer fans.
Yeah.
We don't have to apologize for that. We're from Minnesota.
That would be me.
49 special team. Big.
Kansas, it looks like the Chiefs are going to be
Yeah, Mahomes.
favorites. I'd be okay with the Chiefs.
That's good.
Rams, because the Packers aren't in it anymore. Yeah. I wouldn't mind the Rams. I feel it'd be nice to see Matthew Stafford do well.
It's what? I'm a business. I want to be business.
All right. Well, thank you guys for answering that. All right. So, all right, let me see what you guys think would be best. Do you guys want to kind of go through the questions? I can pull up the poll again. Obviously, it's not going to work for everybody. But if you just want to kind of go through them, we could do that as well.
Yeah, I think you should try it again.
Okay. So I will pull up the poll.
Get some data.
Yep. So again, if you can see the poll and answer it, please go ahead and do that. If you can't, that's no problem. Just follow along. Like I said, I will send out the questions afterwards, so you could have the time to sit down and fill them out. So let me put the poll, and I think Carol, I think you were going to lead this.
So question 11, do you take daily medications?
Oh,
Yes,
we go.
no, or not sure.
You take any blood? Take any?
Just a quick reminder for people to make sure you're on mute, so we don't have any background noise.
So one of the reasons we ask this, especially at the dental office, is that sometimes it can have an effect on your oral health. You can have dry mouth, you could have some inflammation. And so it's really important for the dentist to know all the medications that you're taking when you go to see the dental hygienist or the dentist. Question number 12. Do you take medicine for any of the following? Blood pressure, seizures, allergies, constipation, mood, or asthma? Again, sometimes you can have dry mouth with some of these things, but it's easier for us to know what the medications are that you're taking and how they can affect your oral health if we know what those medications are.
Contact with other players like basketball. If you play contact sports with others, you wear a mouth guard sometimes.
So question number 13, is your saliva or your spit more like, is it thin like water? Is it bubbly or foamy? Is it thick, ropey like syrup, or you're not sure? I think you could tell this more so like if you're going to, you know, like just spit out after you've been brushing your teeth, or even just like you're walking and you're like, oh, sometimes you need to spit. Like, what does that look like? What we want to see is thin like water, because it helps keep your pH level at a neutral, so you don't end up having more acidic kinds of things where you'll have decay. So anyway, you want to have more saliva than not. Let's just put it like that. You drink more than 1 liter or 5 glasses of water every day.
13.
So yes, every day, sometimes no, not usually, or you're not sure. So again, it's really important to drink water. There's a lot of things that we can choose to drink, but water is going to be the best, especially for your teeth and for the rest of your body.
Right here, do you drink?
Question 15, how often does food get stuck between your teeth?
No,
Often, sometimes, rarely. And this, when you get food stuck between your teeth, we look at a lot of different things here. Sometimes it's where the gum tissue has gone away. So you could have some bone loss, which is pretty significant, because when you get food stuck between there and you're not getting it out, you can end up with decay issues as well. So why does that matter? It can be a big deal unless you really like your dentist and spending a lot of time in the dental office, which, you know, if you had Dr. Welly, Dr. Bryan as your dentist, you probably would love that, but most of us not so much.
And sometimes we can fix areas that you get food stuck too, you know, put a filling in there or a crown or something, we can make those areas better. So definitely tell your dentist if you have food traps.
Question 16. Do you play a sport that has contact with other players like basketball, wrestling, soccer, and others? Yes or no? And you know, we
Poly
talk,
hockey didn't make it on the list.
I know,
Poly
yes.
hockey.
But you know that we do mouth guards at Special Smiles, and we'll ask you, do you play a contact sport? Because sometimes, of course, it's going to take an accident or something, and most of us can't prepare for that, so that's why we wear the mouth guards. You can get an elbow to the face. There's a lot of things that can happen, so we want to make sure that your teeth are protected.
Some power lifters wear mouth guards.
Yeah.
Oh, yeah.
They clench together real hard when they're lifting, and yeah, that can be very bad for your teeth as well.
Good point, Nell. I like it. Mm-hmm.
Thank you. Put it in the checking department. Yeah.
So question 17, if you play a sport that has contact with other players, do you wear a mouth guard? Always, sometimes, never. I don't have one. I don't play contact sports.
And a lot of times athletes, even if they do have a mouth guard, they may not be wearing it as properly as they should. Sometimes they chew on the side of it. I know when my son plays hockey, oftentimes the thing's half in his mouth, half out of his mouth. So you always want to make sure it's on your teeth the right way.
So it's nice when they're form fitted, which we do that somewhat. They're not perfect, the ones that we do at Special Smiles, but they're definitely pretty good. Ah. So why do we ask about dental and oral risk? So knowing what is increasing any risk for disease is important. And by knowing what risks you have, you can always make better choices to lessen the chance of problems in the future. So we look at sensitivity, pain, bleeding, or looseness of teeth, early conditions. Sometimes we can't always tell, but looking at not enough quality or quantity of saliva, your history of fillings, wearing oral appliances, some medications in dry mouth are possible risks for problems. And then avoiding trauma to the face or concussion by using a mouth guard is important. So it goes back to what Dr. Brian was talking about, making sure that you wear them properly.
All right, where to next? Let's go to.
All right, so when you look in a mirror and open your mouth, which picture looks like yours? Do you see the back of your mouth? So this is going to be one of those things where I'm sure that you've looked in your mouth before, or you've had someone else, and sometimes they'll say, wow, I can't see the back of your throat. If that's the case, it's going to look more like C or D. Sometimes you're not going to be sure, but if you look back there or have someone else look back there, can they see the back of your mouth?
Hey, shut up. And then left again. Hold up. You did that.
And sometimes our tongue or jaw position can make breathing a challenge, and it could contribute to snoring, especially when you have C or D where you can't see the back of your mouth, back of your throat back there. It's going to be, you're going to have more of a problem with your air exchange.
There's a lot of questions.
Question 19. Do you experience any of the following? And check all that apply. People tell me that I snore loudly. I breathe loudly. I'm sleepy throughout the day. I often find it difficult to concentrate. I'm not sure, or none of the above. And if you have any of these, they could be early signs of sleep apnea. Sleep apnea can contribute to high blood pressure, diabetes, strokes, non-restful sleep, obesity, and stress. So if you experience these, please talk to your physician so they can evaluate you. And some dentists can also help you with some of these, but most of the time you're going to be looking at doing a sleep study before they would make an appliance for you. Dr. Brian, do you have any experience with sleep appliances?
Yeah, we do some of this. We certainly don't specialize in sleep dentistry, but yeah, we've made some appliances that kind of push your lower jaw forwards a little bit, and that pulls your tongue off your back of your throat so you can breathe a little better when you're sleeping. It also protects your teeth from clenching and grinding at night. So yeah, they're very helpful appliances.
Thank you. Question 20. Is it easy to put your lips together and breathe through each nostril? So put your lips together, close off one nostril gently and breathe, and then try the other one. So if it's easy on both sides, you're going to answer the first one. Not easy on one or both sides will be the second B, or you're not sure. So this could easily contribute to sleep apnea and can increase the risk of cavities as well.
I know that.
And this might be something a ear, nose, and throat doctor would more address if they have upper sinus problems or nasal septum deviation. That's
yeah, in dentistry we can identify some things, we just can't diagnose a lot of them. So we're really good at helping people see that there is a potential concern here, and so then we'll refer you to those specialists that can help you. So looking at some of the health risks, getting proper rest is important to be alert and energetic. I mean, we all want to do our best, especially when you're doing a special Olympic event. If we can't breathe easily, it can cause or contribute to other health concerns as well as poor rest. Snoring, loud breathing, difficulty in breathing from your nose can be a concern that a physician needs to be aware of to make proper suggestions for improvement. And plus, maybe if you're snoring loudly, the person next to you or in the next room can sleep as well. So those things are always important too.
All right, excuse me. All right, awesome. Well, thank you, Carol. Again, thank you everybody that was able to get the poll to work and submit your questions. I'm gonna get it tabulated, but I'm gonna have Nell. Nell, if you have a couple of quick stretches that we could do quickly as a group to get up and move in, I'll pass it over to you.
Sounds good.
Guys.
Right? Gonna move your arms.
We open up.
Hi now.
Reach above your arms like this. Those are some of the ones I can think of.
That's perfect. Thanks, Nell.
Hi now.
Yeah, Abby.
Hi, Carol.
Let's quickly go through the poll results. So do you take daily medication? 88% of you said yes. Do you take any medicine for blood pressure, seizures, allergies? Kind of split between yes and no for that one. Is your saliva more like, most of you said thin like water. About a quarter said bubbly or foamy. And then about 31% said not sure.
But now you'll be interested to know. So look at your saliva the next time.
Do you drink more than 1 liter or 5 glasses of water a day? I love to see that majority of you said yes every day. Love to see that. How often do you get food stuck in your teeth? About 54% of you said sometimes. 31% said often. And again, like Brian said, that's something they could potentially help you guys if you go into your dentist with those little pockets. Do you play a sport that has contact with others, like poly hockey, basketball, wrestling, or soccer? 62% of you said yes. Do you play a sport kind of with others, but do you wear a mouth guard? 15% said always. 31% said never. And then 23% said, I don't have one. When you look into the mirror, which picture do you see? It's hard to go back, but most of you said that upper right one. Or can't see, you're not sure. Kind of hard if you don't have a mirror nearby. Do you experience any of the following? Pretty even throughout. People say I snore loudly, 42%. I often find it difficult to concentrate. 42%, I have that problem, usually on a Friday afternoon. But, and then last one, is it easy to put your lips together and breathe through each nostril? 42% said not sure. So, kind of split. That's kind of some interesting information on that one. Thank you for everybody that was able to do that. I know we have a lot of questions. We have about 10 more questions, and then we'll be done with the polls. So I'm going to get it loaded. I'm going to pass it over to Brian, who's going to do the last 10. So again, if you can answer the questions on the polls, go ahead. If not, don't worry about it.
Looks like we had a little better response rate on that last group, 16.
It looks
17.
like it. Yeah. Hopefully it's working a little better.
All right, question 21. Do you want to learn how to have and keep a healthy smile? Yes, no, or maybe? A healthy smile also helps to keep your body healthy. Smiling reduces stress and makes others happy as well. That's what we're learning a lot about, is a healthy mouth makes a healthy body. Do you experience pain in your mouth, especially during eating or after eating? Yes, no, not sure. Pain can be a sign that something is wrong. We want to make sure you are free of pain and able to chew, eat, swallow, breathe, and sleep without difficulty.
Thanks,
Although
Tom.
teeth can sometimes be a pretty poor indicator of a problem. So that's why it's important to see your dentist and hygienist every 6 months, because we can oftentimes find things before they're pain.
Did you want to slip?
Do you have pain inside your mouth? Tell me more. Check all that apply.
Oh, look at the lineup.
Remember, this one might not be anonymous if you do the circle thing. So try to do the poll or message us after the presentation. A, pain in teeth, pain in the gums, pain in stomach after eating, other or none. Definitely want to see your dentist or oral health team to know about the fix. Do any of your teeth feel sensitive to cold, hot,
Go
sweet
back.
foods, or liquid? Check all that apply.
No, we'll go out this way. I'm trying to tell her we're going out this way.
Specifies where that is in your mouth.
Tell anybody for making a U-turn.
No one's around.
Where's the bodies? What's not here?
And sometimes people do just have more sensitive teeth than others. That may or may not be a indicator of a problem. Do you have any difficulty chewing? No. Yes. I have no teeth. I have too many missing teeth. My teeth don't touch when I chew.
Politely turn over. That's the law. Okay.
If you answer any response other than A, let your dentist or oral health team know, see if they can help you.
More training. Hey. That's why they say I can't drive right now. I guess so.
Look at your front top teeth in the mirror. Do you have any chips or broken edges on your teeth? Yes, no, not sure. Chipped teeth may mean that your teeth are at risk for more problems like cavities, lip biting, fingernail biting, or cracked teeth. See your dentist or oral health team to check if you may need a mouth guard. Question 27, we're almost there. Do you see signs of bleeding from your mouth when you brush, floss, or rinse? Is it a reddish pink in the sink? Yes, sometimes, no, not sure. Keeping your gums healthy is very important. Bleeding gums can be a sign of poor hygiene that can be easily treated by your dentist or oral health care provider and yourself. Self-care is probably the biggest part of this one. Schedule an appointment with your dentist or oral health care provider. See if you need treatment or help with brushing and flossing.
Cavities? Well, that's not the bodies. Well, whatever. You'd add that.
Dental urgency. There are times when you, oh, my screen is in the way here. There are times when you should not wait to seek care. If you answered yes to any of the last 5 questions, you should seek advice or treatment from a dentist or a healthcare team as soon as possible. Let someone who helps you, family member, coach, care provider, know that you need to find help. If you need to find a dentist, try to reach out to Special Olympics, and we have some resources that we can try and put you in touch with a dentist that. Yeah. And 28, did you learn something new today? Yes or no? And if you could have a one-to-one Zoom virtual consult to ask a dentist or a healthcare provider question, would you be interested? Yes, no, or maybe?
And again, for this one, if you are interested, I'll have my contact information at the end. So you can reach out to me directly and we can kind of work something out for that one. So last question.
How many times have you participated in the traditional Special Smiles screening? So this is the one where we did it at the events, and you'd come through our Special Smiles area. Because we all know that this is the first time virtual for Special Olympics.
All right.
That's too intense.
Perfect. So I will, I'll let the kind of last couple answers trickle in for that one. So thank you for that one. So again, like I mentioned, if you do have kind of a more of a personal question, or if you do want a one-on-one, my email is listed right there. So feel free to reach out to me directly, and then I can kind of work with you to see if we can get something figured out so you could have a more of a private conversation if you have any specific concerns with that. And then if you do have any specific questions right now for any of our clinical directors, if you want to type it into the chat, go ahead, and then we'll kind of pull them up and answer them. I know I have one question that someone asked before that I'll throw out there right now for both of you is they're asking how important sealant was or is. So if you guys want to talk a little bit about that.
Yeah, sealant is extremely important. We would love to seal teeth before they get a cavity. That's kind of the whole point of a sealant, is to protect a tooth. In the most common area that we see cavities, in the biting surface, right in those deep grooves on the top of the tooth. That's where the vast majority of cavities happen. So if we put a sealant in that tooth, our hope is that we can prevent a cavity from happening. Prevention is a huge initiative of dentistry. We would love for problems to not come up and try to, fix things before they're major issues. So sealants are very, very good. Along with fluoride, maybe Carol can talk to us about fluoride a little bit.
Sure, and I'll tell you about sealants too. When they're done really well, they last for a really long time, because Krista still has them on her teeth, and I did them probably 20 years ago. So they're very, very helpful. But fluoride is another one of those things where when you come into Special Smiles, we'll ask you if you want to have basically vitamins for your teeth. And it helps strengthen that enamel, so you will be less likely to get decay. And the fluoride varnish that we provide, we can do every 3 months. So if you go to your oral health care provider and you've had it done, and then you come into Special Smiles, 3 months later, we can do it again. And it doesn't harm your teeth unless you're doing that level of fluoride every day. But if you had it 2 months ago and then you got it again, it would be good. But very, very helpful to help prevent decay, and also using a toothpaste that has fluoride in it, and then also a rinse that has fluoride in it.
I know.
Awesome. Perfect. And then just quickly to go over the poll results from the last section. Do you want to learn how to keep a healthy smile? I love that 82% said yes. Really interesting that 71% said they had pain in their mouth, especially during or after eating. Do you have pain in your mouth? 31% have pain in the teeth, 19% in the gums. Any sensitivity to cold, hot, or sweet foods? 56% said no, which is great, but it is kind of split between upper and lower teeth at 25%. 88% said they had difficulty chewing. If you remember, if you answered yes to any of those questions, it's important to make sure you go see your dentist or oral health care team to get any of those addressed. 81% said no chipped teeth. 50% says sometimes they see bleeding when they're brushing or flossing their teeth. 93% said they learned something new today. Well, that's awesome. Love to see that. And again, if you are interested in a virtual one-on-one consult, just reach out to me directly. So again, thank you everybody that was able to get the poll submitted. Again, I will send out all the questions afterwards. If you want to answer them and send them back to me.
No, just one, couple, 3 other new jobs.
Any other, it looks like you have questions. You will get a dental goodie bag that I will send to you. It'll probably have some of the same things that you get at some of the other in-person events, the toothbrush, toothpaste, floss, kind of what other little goodies you can find. So you will get that. Any other questions for our clinical directors? Otherwise, looks like we do have one. My teeth are really tight and very hard to floss. So what's a good floss that they could use?
So if you have really tight teeth, Glide is the brand of floss. It's kind of a slipperier, like a white Teflon tape. So Glide. There's probably other brand names by now that have more of that ribbon kind of Teflon, but that's always been the best one. We also like these flosser tools. These are really great. They have like 1 inch of floss. These ones you kind of like almost bite them down sometimes if your teeth are a little tighter, but yeah, you definitely could maybe even check with your dentist. Sometimes there's things we can do to maybe loosen them, but tight teeth are actually a good thing because that keeps the food from getting stuck in your teeth. So
and then kind of a follow-up question to that, they're curious, does it break easy? Because they said that seems to be a problem.
it
Well,
could
they
be
can.
technique too.
Yeah. You need to seesaw it back and forth,
Mhm.
especially when you use the Glide, and then just kind of gently go down into that space there in between the teeth. But if it breaks, then you're going to want to take another piece of floss over the top of it and pull it down and then pull it through instead of trying to bring it up, because that will jam it even further.
Maybe tie a knot to, if you get something stuck in there, you can kind of, but yeah, up and down flossing. Yeah. We oftentimes see that where we ask people to kind of show us how they floss, and they're doing the side to side thing. And well, maybe we need to work on the technique a little bit there.
Awesome. Perfect. And I know we're kind of getting close to about that hour mark, and I know that's kind of how long we were kind of hoping this would take. But I would love if you could stick around. We'll just a couple minutes longer. One thing I would love to have you show is give us a quick demo on how to properly brush our teeth. I know you might have a large hand that you might be.
Okay. Whoa, look at those teeth. Aren't those, who do you think, like Paul Bunyan maybe had these teeth in his mouth, huh? Maybe these are Paul Bunyan's dentures. And then we have a extra super duper big toothbrush to match that. But when we brush our teeth, we definitely want to brush the top biting surfaces, and we kind of want to start in one spot and kind of move kind of methodically, slowly throughout the area. And then you kind of switch it over and do along the gum line. That's really probably the most important part is right along the gums, more of an up and down.
The bark cream soda peach.
Just really try to avoid like sawing your teeth. We can see a lot of damage from people that really brush too hard and kind of saw too much. But just be pretty gentle. Electric toothbrushes are great. You get a lot more brush strokes per second with the electric toothbrushes. So they've been very helpful, but just make sure you get all the areas. You don't want to miss any spots. That's pretty important. And then, like I say, the flosser tool just goes in and out.
Sure. But he can't grow there for a whole year. I don't think they should put that back.
And if you are using an electric toothbrush, feel free to bring it with you when you go to your dental appointment, just to make sure that you're using it correctly. because sometimes we like to do the sawing motion, and with those electric toothbrushes, they do the work for you. So if you sometimes, for me, someone demonstrating it to me, it makes it easier for me to understand. And that's what we're there for as oral health care professionals, is to help you do a better job at home.
Signed up. I didn't know you had to be
Awesome. Perfect. All right.
to win the jersey. Try to win it.
Okay, so let's, so I kind of have a little more of a specific question kind of for you guys. I'm gonna pull it up. So I'm curious, and this kind of goes back to finding a network for some of our athletes. They're curious if you have a referral for any oral surgeon for possible wisdom teeth removal. Looks like a couple locations that they've looked at doesn't have an oral surgeon on staff or even available. Curious if you have any recommendations, questions about orthodontics for a child who has huge sensory issues and doesn't tolerate the dentist well. So if you guys have any good recommendations for places,
Well, oral surgery, I know Dr. Dan Sampson, he used to volunteer with Special Olympics. He did the Special Spouse program for several years, and I know that he's helped out some of our athletes. So if you connect with him, I would imagine that he can still see, some of our athletes and tell them that's how you got connected. And if not, then you can find me, because I can probably find someone else that can help you.
Okay, perfect. And like I said, if we need to connect after this, we could certainly connect to kind of have that more of a conversation with Carol, whoever it may be, to help make sure we find that location. But yeah, I know they have one as well. Maybe this might be a good one. If there's any places you're aware when dental insurance doesn't cover and money isn't available, so they might be able to get treatment.
That's a tough one. There's a huge problem with access to care. And if you can't go to Apple Tree Dentistry or some of the community, there's a bunch of community clinics. And I think that there is a sliding fee schedule that they will use based on income. So the community clinics might be worth looking. I mean, they will be definitely worth looking into. I don't know what the wait time is, but there's a community clinic in Robbinsdale. There's one in St. Paul, like Maplewood area. And then Rochester has one as well.
But until they get their other apartment, if they get to another one.
And again, we can connect after the meeting as well, if we need to have more of a conversation regarding those. So, but I just want to quickly get the last couple slides in, so people need to run. Just a couple kind of quick reminders. Disability Hub Minnesota is a great resource. If you do have questions about finding resources or health insurance questions, they're going to be a great resource going forward. Their contact information is on the bottom of the slide. And I can certainly send these slides out to anybody that wants them. So if you want that information, I can make that available to you. But they're a great resource that work with people with disabilities all the time, and they're going to be able to help answer a lot of questions you may have. Some upcoming events. We do have a Family Health Forum and Leadership University Summit on February 19th. It's a one-day in-person course that will cover topics including healthy living and balance for athletes and families, health and leadership, advocating for your health, and incorporating health practices at competitions. If you're interested in this event, you can find more information on Special Olympics website, or you can send an email to Lindsay Ryan, and I have her email listed right there as well. So she's the one that's kind of organizing it. Follow up with that. Fit 5 Pledge. It's a great program that helps you focus on creating a healthy lifestyle, which includes exercising 5 days a week, eating fruit and veggies, drinking 5 bottles of water a day. They are doing that if you sign up for the pledge. After the winter sports season, they're going to pick 3 winners to receive an at-home fitness kit, which includes a yoga mat, stretch band, and a pair of dumbbells. So pretty cool. And then finally, just a quick thank you for everybody for jumping on. Reminder, you will get a little goodie bag sent to you that will have some toothpaste, toothbrush, floss, what other goodies I have. I know we do have some mouth guards available, so maybe I'll send a mouth guard. I think I saw a request come into the chat for a pink one. So I may send one as well. But then you are also all entered in to win a chance to win a Minnesota Wild home jersey, which are pretty sweet. So I will pick a winner after the presentation today, and I'll reach out to whoever the lucky person is next week. And then if you would love to do an in-person Special Smiles event, we're hoping to have our next one at the Summer Games in June. So if you want to come meet Carol and Brian and some of our other clinical directors, it's going to be a great opportunity to meet them in person. And hopefully we will be in person for that one.
Free dental goodie bag sent to you.
Look at the gummy fish.
Yes, yep. So when you registered, you had to put your address down. So I have everybody's address, so I will put it in the mail. So nothing else you have to worry about. So
yeah, my address, I live in Maryland too.
That's no problem. We'll send it to you.
Okay.
Might just take a little longer.
All right.
But perfect. Well, again, if there's no other questions, again, I want to say thank you for everybody for jumping on and giving this a whirl. I know there were some kinks we had to work out, but hopefully everybody took something from it. And you'll probably get a follow-up from me with the questions, and then we'll hopefully a little survey. But
Hey, Jeff.
Yeah.
The first 10 questions, I didn't get a chance to submit them. I got them all answered, but I didn't get a chance to submit them.
No worry. I'll send out the questions afterwards. So you won't have to worry about that. So if you want to fill out the questions and send it back to me afterwards, we'll do that. So no worries.
Okay.
Again, if you do have any questions or want to stick around and chat, feel free, but otherwise you can hop off if you want to. So again, thank you and enjoy the rest of your Saturday.
Thanks, everyone.
Thank you. Thanks, Jeff. Thanks, Chris.
Yeah, thank you guys. I may stick
Carol.
if you guys want to stick around.
Yeah.
Yeah. It's fine.
Let's see. I think I saw